One group at high risk during the pandemic is people who are battling cancer and people who are recovering from cancer treatment. They have, of course, compromised immune systems. Joining us with his insight, Singing River Systems oncologist Michael Finan. Dr. Finan, thank you so much for joining us.
Oh, you're welcome. Glad to be here.
Yeah, these are really difficult times for all of us, but these times really do pose specific challenges for people with cancer. I mean, it's a lot more dangerous out there for them because their immune systems really can't handle anything else.
Absolutely, and we've dealt with the COVID crisis head on. I think we're probably one of the safest places to be because we screen all of our. We've been screening all of our employees during the peak of the crisis, and we continue to screen patients. And with temperature for everyone walking in the building, the questionnaire that's asked is pretty thorough and detailed. And you can't physically get into the building without being screened.
Right. And how difficult has it been for patients coming in for treatment if at times, maybe earlier and maybe even now, I'm not really sure what you're doing now, they weren't able to have anyone with them, or are they generally able to have someone there during their treatments?
Right. During the majority of this crisis, we've followed the guidelines of the health system, the Singing River Health System, and we have not allowed visitors except in certain circumstances. We do have some flexibility, but it has been tough on patients because cancer is such a stressful time. You really need someone with you. That's a critical support that patients come in either with a family member or a close friend. And unfortunately, we have not been able to allow that until very recently. We're currently allowing one visitor with each patient. But even during the crisis, if I saw a patient that was a newly diagnosed cancer patient, I would have the nurse bring the family member back with a mask and with the right precautions. So we did make exceptions in certain cases.
Right. I mean, for people just being diagnosed, I have a couple of close friends who were, and I know I wasn't able to go with them, but they were able to take at least one person, their family member, with them. And it's hard, though. It's hard on everyone around them, too, to not be able to be there for them as much, whether it's at the hospital or at home, caring for them.
Absolutely. And it has led to some anxiety and depression, as you might expect.
Tell me a little bit about the problem with the blood shortage right now, too, because that's another side effect of all of this. Fewer people are donating, I'm guessing, because fewer people are getting out. And actually, cancer patients are impacted by this as well.
Absolutely. Well, I'm speaking, not only, I'm cancer center director, but I'm also a gynecologic oncologist. So I'm a surgeon, and I also give chemotherapy. And we use a lot of blood. Cancer patients in general, whether they're having surgery that results in blood loss that leads to a transfusion, or chemotherapy that drives the blood counts down and leads to the need for a transfusion, we're experiencing a double whammy because spring and summertime is normally a time when the blood supply dips because people are traveling. They're not so focused on others. They're more focused on vacation or family activities. So then you add COVID to that, where patients either can't go out or they're afraid to go out. The blood supply has just severely dipped, and we are in what's called a crisis mode. And I would like to reach out to every single person who's watching, who's got a family member or a friend with cancer. Many times, family members, friends, coworkers are looking for some way to help. And the most common thing is to bring a casserole. I saw a patient yesterday, one of my patients who was getting chemotherapy. She said, if I get another casserole, I don't know where I'm going to put it because my freezer's full of casseroles. But what you can do that's truly helpful and meaningful and will actually save lives is donate blood.
All right. That's a very good point, Dr. Michael Finan. Thanks so much for joining us from Singing River Health System today.
Absolutely. Thank you.